Knock, knock. Hi, my name is Elizabeth. I'll be the nurse performing your routine physical today and reporting my findings to my instructor. Do you have any questions before we get started?
No.
Great. I just washed my hands and I'm going to close this curtain to ensure our privacy. Can you tell me your name and date of birth?
Delaney Canton, June 4th, 1997.
Great, thank you. I'm going to start by taking your blood pressure. First, taking your systolic. Putting it 1 inch above your elbow. Great. Your blood pressure was 112 over 68. Next, I'm going to inspect your skin and perform a skin exam. Have you had any recent rashes or lesions?
No.
Do you have any family history of skin disease? Great. Just inspecting. I see that your skin is even and smooth. It is appropriate for your ethnicity. You have no cyanosis, pillar, or redness. Your skin, you do have a few flat macules on your arms, which is nothing to be too concerned about. I see no edema in your legs as well. Next, I'm just going to pinch the back of your hand for hydration test. Your skin is easily mobile and smooth with trigger tests showing rapid recoil. Next, I'm going to palpate, or I'm just going to feel your skin's temperature. Your skin is warm and smooth, and your face is dry, and your skin is moist. Next, I'm going to assess your lungs. Have you had any family history of lung disease?
No.
Do you smoke?
No.
Have you had any trouble breathing or coughing recently?
Mm-hmm.
Great. Just inspecting your lungs, I can see that you're having no nasal flaring or retractions, no cyanosis or pillar. You also have even thorax expansion, and your anterior-posterior diameter is less than your transverse, which is normal. Next, I'm going to listen to over your trachea. Bronchial sounds are clear. Bronchial vesicular sounds are clear. Next, I'm going to assess your vesicular sounds. We have stand up for me. I'm going to assess the sound on your back. Great. Your lungs sound great. I heard no extra sounds such as rales or wheezing, and vesicular sounds were clear. Next, I'm going to assess your abdomen. If I could have you lay down for me and bend your knees. Perfect. Have you had any changes in appetite? Any recent nausea or vomiting?
Mm-hmm.
Great. First, I'm going to listen. Starting in the right lower quadrant. And moving around and up. Great. I hear active bowel movements, which is good. Next, I'm going to use my bell to assess your abdominal arteries, starting with the aortic, renal, iliac, and femoral. Great. Your arteries also sound good, and I heard no bruise. Next, I'm going to start with light and then deep palpation, just feeling for any tenderness, abnormal enlarged organs, or masses. Starting in the right lower quadrant again, and working around. And now deep palpation. Do you feel any pain?
No.
Good. I felt no enlarged organs or masses or rigidity. Next, I'm going to palpate your liver and spleen. Great. Your liver and spleen palpations showed that it was within the normal limits. Now I'm going to assess your cardiovascular system. Can you tell me if you had any recent chest pain?
No.
And do you have any family history of heart disease or heart attacks?
Mm-hmm.
Great. First, I'm going to assess your peripheral pulses, starting, thank you, with the carotid. Sorry, my fingers are a little cold. Then moving on to your brachial, radial, femoral, popliteal, posterior tibialis, and dorsal pedis, which is on the top of your foot. Good. Peripheral pulses are strong and 2+ bilaterally. Next, I'm just going to listen to your heart. First, starting at the aortic, which is the second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fifth intercostal space, left sternal border. And mitral, fifth intercostal space, mid-clavicular line. Great. Now I'm going to auscultate your apical pulse for a minute. Your apical pulse was strong at 72 beats per minute. I heard normal S1 and S2, with S1 being loudest at the apex, and no extra heart sounds or murmurs. Next, I'm going to be assessing your eyes. If I could have you look straight forward, I'm going to shine this pen light. Great. Pupils are equal, round, reactive to light, and accommodate bilaterally at about 3 millimeters. Next, I'm going to assess your neck. First on me if you had any neck stiffness or rigidity recently. Great. I'm going to first feel for your lymph nodes, starting at the pre-auricular, post-auricular, submandibular, submental, tonsillar, anterior cervicular, curvicular, cervical, and posterior cervical, supraclavicular, that's the word, and inferior clavicular. Great. I felt no lymphadenopathy at all 10 nodes, and all nodes were distinct, mobile, and non-tender. Next, I'm going to be assessing your muscular skeletal. First having you, we take a couple steps that way for me, and walk back. Great. Your gait is even and smooth with symmetric iliac crest. If I can have you stand up one more time for me, I'm first going to assess your hyperextension. If you could just bend your legs back. Perfect, that's good. Now I'm going to keep doing some range of motion activities. If you could do flexion for me, just straight flat, lift them up. Perfect, and now if you could pull your knee to your chest for hip flexion. Great. I'm going to have you do internal and external rotation of your and lastly, I'm going to have you abduction, adduction. So out and in, out and in. Perfect. That was abduction and then adduction. Next, I'm going to move on to your shoulder muscles. If you could sit up for me. Your shoulders look even and with no contour deformities. They are symmetric as well. If you could first do flexion, extension, abduction and adduction, internal rotation, and external rotation. Great. Your shoulders show active range of motion at 5 bilaterally, which is great. Next, I'm going to move on to your neck. If you could do flexion for me, hyperextension, rotation, and lateral bending. There you go. Ear to ear. Perfect. Your neck also shows active range of motion at 5. Next, we're going to move on to your elbow. If you could flex your elbow for me. Thank you. And now extend your elbow flat. Perfect. Elbow again showing active range of motion at 5. If you could, now we're going to move on to your knee. If you could do knee flexion for me. But you're going to have to stand up, sorry. And pull your knee to your butt. Perfect. And I can, by just inspecting, I see that you have distinct contour and concavity in your knees, which is great and normal. Now I'm going to have you, I'm going to assess your spine, if you could stand up one more time for me, and bend down for lateral bending. And I can also see the curvature of your spine, which shows no curvature or scoliosis. Next I'm going to have you do hyperextension, rotation, just like you're cracking your back, and lateral bending. Perfect. Now I'm going to move on to, you can sit down, to your, one more time, I need to assess your side pain. If you could lift your legs both up straight. Did you feel any pain? Mm-hmm. Great. Your spine has a normal curvature with active range of motion at 5 and no sciatic pain. Now I'm going to move on to your wrists and hands, which look good. If you could do flexion and extension. If you could make a fist and then touch each thumb to each finger. Perfect. Your wrists and hands show active range of motion at 5 as well. Lastly, moving on to your ankle and foot, if you could do plantar flexion, which is bending down, dorsiflexion up, inversion, move your leg, perfect, and eversion out. Great. That's showing me, again, active range of motion at 5 bilaterally, and it appears your strength is good. Now I'm going to be moving on to your neurovascular exam, and I'll be asking you a series of questions to assess your cranial nerves. The first cranial nerve is the olfactory, and if you could close your eyes for me, I'm going to have you differentiate between 2 smells. Tell me what the smell is.
Nail polish.
Great, and one more.
Peanut butter.
Perfect. Now I'm going to be assessing your second optic nerve, which is, or your second cranial nerve, which is optic. If you could stand up and right around here, look at this eye chart and cover your right eye and read the third line.
2843.
And then cover your left eye and read the third line.
2843.
Perfect. That was great. Your optic motor is also intact and looks good. Now I'm going to be assessing your ocular motor, your trochlear, and your abducens by having you follow my finger to assess your cardinal nerves. Great, those also look intact. Now I'm going to be assessing your trigeminal. Can you clench your teeth? And move your jaw side to side. Great, that also looks well. Next, moving on to your facial, if you could smile and puff your cheeks. Good, that's also symmetric and looks good. Now I'm going to assess your acoustic. I'm going to do the whisper test. And if you could tell me what I whisper in your left ear. 3. In your right ear. Great, that looks acoustic nerves also intact. Now moving on to your glossopharyngeal, if you could open and say ah. Good. Your uvula is midline. Now I'm going to assess your spinal accessory. If you could push or try to push your shoulders up against resistance. Good. Next and last is your hypoglossal. If you could stick your tongue out and move it side to side. Perfect. That's also good. All cranial nerves are intact and show that she's active and can perform those. Now, I'm going to lastly assess your deep tendon reflexes. First, I'm going to assess your biceps. Now I'm going to assess your triceps. Your brachioradialis. Your patellar. If you want to sit on this pillow, yeah. The other side. Great. Now I'm going to assess your Achilles. Good. Yep. And put your foot down. And lastly, your plantar reflexes. Great. Her all reflexes were equal bilaterally at about 4+. And that concludes my physical exam on you. Thank you.